It is very person specific because you could come to me and you've had Invisalign 3 times. You had braces growing up for 5 years. You had Invisalign twice. Your teeth keep shifting and you also had LASIK eye surgery. Like that's going to be a complicated case. Or you could come to me and you've never had braces in your life. You've never had any head injuries. You just have some TMJ problems out of nowhere. So whatever, you had something pop up. And typically there's always a reason as to why it happens. It's never really out of nowhere. But so I can't ever really say how long it's going to take because it really depends on what that person has been through. However, I do see changes in people. Now, visible changes take time. My posture has changed, but I've been doing this for 3-4 years myself, or even longer, to be honest, but really focusing in on it in the last 4 years and doing things with my teeth and doing things with my eyes that have made a significant difference for me. And that's what I have needed. Not everybody needs that, but I do see major changes with people's cervical spines. And to the point where I can feel that there's a change. If we image them, I don't know, it could be a change. However, the person feels better. So what's not to say in 2, 3, 4 years from now later that their neck is going to be in a better position as well, despite how much work they do on a computer. So a lot of times people don't realize it's a lot of other accessory things, LASIK eye surgery, all these other things that could be contributing factors. The glasses people are wearing, what they have on their teeth and what they have on their feet. It could be pretty significant contributing factors.
Well, how do you said people feel better? What does that mean for some people? Like what's better for them? What do they experience?
Well, if somebody comes to me in chronic neck pain after 4 sessions, they don't have that anymore. They're not experiencing that they wake up in pain every morning. To me, that's a goal right there. That's awesome.
But what about unexpected benefits? Let's say if someone has like significant forward head carry, maybe they feel okay or they think they feel okay. There's nothing like really irking them big time, but they don't like how it looks. And, if you've restored someone's neck position that was like that, what would they tell you that were the benefits? Maybe some they didn't expect or they were surprised.
Sure. We get a lot of changes with people's sleep, feeling deeper, just feeling lighter overall. If somebody has headaches and migraines, things like that, changing. So it is very person specific. I mean, I can tell you a bit about my own little story here, which is something that I never expected. I learned a lot of postural restoration living in Texas. I went down there to learn from a mentor. And when I was living down there, I ended up getting my eyes looked at. I've worn glasses since I'm 15 years old and I never had glasses. Nobody in my family has glasses. I had a head injury when I was like 13. I probably got glasses around 14 or 15, probably seriously wore them around 16, 17, 15, around then. When I started driving, I really started to need glasses. Anyway, so I've been in glasses for years and years and years. And as you're in glasses for a long time with a myopic prescription, typically it goes up. That's what typically happens. That's exactly what happened to me. So now 15 years later, 12 years later, whatever amount it was, I'm in Texas. I get my eyes looked at and he looks at me and he's like, "You're very overcorrected." So I was overcorrected by a full diopter in both my eyes, meaning if I was a -2, which I about was, that means that I really needed to be a -1. So what my eyes are doing all day is pinhold, having to dress my nervous system to look very perfect, to see super, super far and perfect. And in this time frame, my glasses prescription was stayed around the same level for years. And then I became an Olympic weightlifter. So 4 years prior to that appointment, I became an Olympic weightlifter and my eyeglass prescription went up during the time I was doing weightlifting. And that was also when I stopped sleeping. So I had pretty bad insomnia for 4 years of my life. And it was really, really rough. And I can relate to a lot of my patients that come in and that's their issue. So in some ways it makes me more relatable, but also it was a really hard time of my life where I did not sleep. I've had to, take sleep medication and ended up getting these newer, lower prescription glasses. And within the first week of being in them, my sleep changed. And it's not like it goes from being in insomnia to, wow, I sleep perfectly now. That's not how it works. But I went from sleeping 3 to 4 hours, couple nights a week and maybe, really, really poor sleep to now sleeping 5, 6, 7 hours. And to now 2, 3 years later, I sleep, 7 to 8 hours every single night. I don't struggle really at all with sleep. Was it my glasses? Was it my stress bucket being too full? All I know is that when I got out of those older glasses, that week I felt some wild changes. And since then, sure, I still had nights of poor sleep, but that was a very big turning point for me. Now, that is a very rare thing. That's not what we always see, but I do have people, and I just had a patient text me this morning saying he didn't wake up with a cortisol rush in the morning. He usually wakes up ready to go, fired up, kind of like jumping up out of bed instead of like slowly getting up, having a nice morning. So I do see a lot of very interesting benefits that everyone is different. So I don't always know. I've had people where their constipation changed. They were able to go to the bathroom like post-session within the hour, and they usually struggle with constipation. And now they use that for being able to go to the bathroom. So you're really playing with the human body. So quite different for everybody, but it can be so powerful, which is amazing.